Is your dental team burning out? Are they super stressed and you want to help and you just don't know what to do? This is Paul, Dr. Nacho Goodman, talking with our awesome sponsor, Support DDS, and Dr. Nikki Green about how to make your team feel like this, less like this on the inside. This is where all dentists and teams have to keep their crying on the inside part of their body. So excited to be talking with both of you. Dr. Nikki, you are a fellow dentist like me. We went to school to become professionally weird. Nobody told us how to manage teams, what to do. We were just thrown into this world doing it. And you have found through Support DDS, our awesome sponsor, and Callie, you can wave hi to everybody. Callie, we'll get to you in a second. Support DDS came to what I maybe will call your sanity rescue. Tell us, before you use Support DDS, what hurdles are you experiencing? What cry inside things were happening in your house of dentisting?
Yeah, I think you described it well. My front desk team was burnt out. And honestly, I didn't even necessarily know that they were burnt out, nor did they. But luckily my desk sat strategically very close to my front desk. And there were just things I got tired of hearing. I got tired of hearing my front desk being locked on a 20-minute phone call with an insurance company. Thus, they weren't able to be patient forward with someone who was trying to, we were trying to collect payment from or get their next unscheduled treatment on the books. And so I realized, okay, something had to change. So Support DDS kind of came along right at the right time when we were getting way too busy for my front desk team to be doing that kind of stuff. So that was our lowest hanging fruit. The first team member I ever hired from Support DDS was in 2017. And the very first thing I taught her to do was verify insurance. So we trained her on our insurance verification form, the way we like to ask the questions, and we'll let her spend 40 minutes on the phone, but not my front desk team member.
Love that, Nikki. During the pandemic, I don't know if you've seen Frozen 2, but I've seen it like 837 times. There is a song called Some Things Never Change by Olaf, the snowman. And some things never change, dentists not wanting to change. I'm going to market that. Someone asked Frozen if that's allowed. But you have this pain and you get this team member, and Callie, you can chime in too. How did you get your team to use the help that you were providing? You said, hey guys, we're getting help from another country, a remote team member, something fairly new to dentistry, not new to earth. How did you manage that change and transition?
I mean, at first, I'll be honest, there was a little difficulty. It was 2017. It was pre-pandemic. It was pre-people working from home. And so, that did not seem normal to my team. And so I had to convince my team a little bit. I even found that my very first team member, I had to do the majority of the training on the phone with her, training her how I wanted my insurance verified, because my team was they did drag their heels just a little bit. But once she got up and going, I mean, I would say within the first 60 days of her being with our team, now my team was looking for what else they could give our Support DDS team member. So that's certainly not the problem anymore. All it took was getting our, boots on the ground and start running with our Support DDS team member, and they came along.
I hope you do what I do to my team and remind them that I told you so many a times when they don't want to do a thing and then they do it. This is a true story. I went to my office manager during the pandemic and said, we're outsourcing insurance verification, too much going on. We're going to outsource it. She said, Paul, I don't want to outsource it. I said, Kate, we're going to try it. She said, I don't want to outsource it. We don't need it. I said, we're going to try it. She recently told me it was the best thing I've ever done for this. So you cannot always listen to objections, especially as a leader. I have a test, not guess thing. I have a let's try it for 60 days. Callie, you're part of the Support DDS team. How do you deal or help offices deal with this change? Because in all honesty, it is a change to work with someone outside of your four walls. I've been in the dental profession with my dad as forever, born into it. Outside up until 20 or whenever we had our first one, we'd never had anyone kind of working outside of our four walls. So Callie, how does Support DDS help with this?
Well, if you think about post-pandemic, right? We are feeling the crunch. We've lost team. We are overstaffed or understaffed, overworked. And the team members that we do have, their best time is spent with our patients, engaging and being present. Right. And there's so many things that we do reactively as opposed to proactively in a practice. So when you hire our team member, you're hiring a team member. You get to be in on the interview, you get to pick, you get to have a say. and they can do whatever it is that you want to train them on. So Nikki has them doing insurance verification. You could have them back up on phones or first on phones. They can do recare, reactivation. So think of somebody being proactive, making phone calls every day to keep the schedule full, as opposed to panicking to fill the schedule tomorrow. And then I quit making calls because I'm still doing all of this. So it really is a solution that is empowering. And I think the thing that really struck out to me, I've been a consultant for 7 years, and now I'm with Support DDS, was the fact that they're college educated, they are bright, and they're excited to spend an hour on the phone with the insurance company because they do want to grow with you. They want to belong to a business, and they want to provide value. So they show up with the energy and enthusiasm that I just haven't seen anybody in the States have for insurance verification, or all those gritty things that we have to do in a dental practice that just kind of get.
And I think one of the things, and you make really good points, because they're working in a sort of a distraction-free zone. And I think when you're trying to verify insurance or do the things while you're in that distraction full zone, otherwise known as the dental office, I think one of the things front desk teams don't get enough credit for is they just kind of got to be ready for anything. They got to pick up the phone and just deal. Someone's got to come out and do this. Nikki, we can go run and hide. Like I hide in my office. My hygienist is calling my name. I go, they'll stop eventually and find someone else. But the front desks are in a no hiding zone. So I love that. So just to catch everybody up, we're talking with Callie Ward of Support DDS, awesome Nacho sponsor, Dr. Nikki Green, sharing with us how Support DDS has helped them. If we just pause for a second, Callie, if someone was watching right now and they wanted to reach out to you or Support DDS directly, what would be the best way for them to do that?
Simple. You can go to our website, supportdds.com. You can send me an email, Callie at supportdds.com, CALLIE. Simple.
Awesome. And people can text support to 215-543-6454. So now, Nikki, I wanted to play professional basketball in the NBA. That did not turn out. I failed. But let's use the passing of the ball. You get them to pass insurance verifications to your Support DDS team member. Now, what other things are they passing off of their front desk team or admin team plate to decrease stress in their lives?
Anything they can, but
yeah.
The second thing we went to is some of the things Callie's talked about already is recare and reactivation. So those lists that we create every week, the old recare systems where we see who's due next month, who was due last month, who was due 3 months ago, 6 months ago, the verbiage. And so no one ever wants to make those calls, right? They feel like cold calls. Again, I don't know what the stigma is about some of these jobs at the front desk, probably because everyone does realize, common sense tells us that we would rather be patient forward. We would rather be scheduling treatment with the patient in front of us, answering their questions, chatting with them about what they had for dinner last night. All those things are so super important. So no one wants to make those recall and reactivation calls. So that's the very next thing that we had our ZimWorks employee doing. And that's really about the time it started getting to where we needed a second one, is when we went 3 and 4 hygienists across and we're calling on recare. That's where we went for our second full-time Support DDS employee.
And now I've been, this is so great that you're sharing this. My assumption is your team can't work without them now. My assumption is, your team does not want to go back to a non-Support DDS world.
Right.
One of the things, it's a true story. I just use these for my jokes. I ran a study club in like 2010. The speaker talked about texting your patients for reminders. We don't use them at this time anymore. Then I have a sponsor, but we had used Solution Reach. I don't remember Solution Reach. I went back and I was like, hey, everybody, let's try Solution Reach, right? We can text our patients. We always get so frustrated they don't show up. They no-show us. I actually, in my cockeyed optimism, like Seinfeld, I thought they would be happy. They go, the patients want to hear our voices. I go, you're just a liar. But I said, let's try the texting. So we'd have 57 appointments. And this was new age stuff back then. 37 of them would turn green at the text. One day Solution Reach goes down. They're yiking and complaining. They had to call people. I go, oh, I thought everybody wanted to hear your voices. So I love I told you so, because our teams, sometimes when you're working inside of a box, you just don't know how to solve the pain in your box. Dentists need coaches, front desk teams need this. Callie, I want to ask you, you guys are helping dentists all across the country. Nikki, you have a practice in Texas. Is it one location, more than one location?
I have one location, and then my husband has another dental practice, similar size. It's 120 miles away. So we run them together. Between the two of us, we have about 4 support DDS employees.
Between you guys. And Callie, you guys also help group practices? Like if someone had 4 practices, is support DDS a good solution for them?
Absolutely, absolutely. And then you have the synchrony of just training one time with multiple team members, which is way more effective on your time, right? And if we think of thinking outside the box, we're not only in those lanes. I think one of the most uncomfortable call for somebody up front in a dental office is calling somebody who owes us money. And we now have a class for revenue cycle management. They can follow up on the insurance claims. They can call outstanding patient accounts. So when you think about what your team doesn't like to do and what's the less money spent on their time, it's keeping them patient facing and having everything else be proactive in the practice and have somebody making those outstanding balance calls, because you need to get collected, or making sure that we're verifying insurance correct on the front end so that we're estimating correctly and collecting at the time of service. So it is outside the box. There's so many different things that we can do, and it really, we have to be willing to try something and play with a new thing if we want to see a different result. So if you want to stay where you're at, you're going to get the same result. But if you think, man, I'd love to see a little bit more on my collections, and I'd love to have my front desk happier when they come in the morning, this could be a solution for you.
Yeah. I mean, I also think you're sharing such great stuff. I work with my Nacho team right in this moment, and we just had a big conference, and there's probably like 16 emails about people couldn't get their CE correct, right? And that's always happens. And if I said, hey, Amanda, go call these people, it's going to drag your energy down, right? They're going to say, so when you call those outstanding balance calls and then you have to go back to the front desk and be nice to people, it really is it's not the right alignment of energy, to use a new age term, right? So it's like, kind of keep those challenges. And I feel for my front desk in those words, because it's like, it's not fun. It's our fault, Nikki, that they didn't pay, right? It's our fault as the practice owner.
That's right.
I mean, what happened to us? Every other service, you just go and pay. Patients think at the dental office, it's just a friendly suggestion if you would like to pay. So, I mean, I feel for them in doing that, but it always is, maybe there are some dentists who make their own collection calls, but that's not me. It's too much conflict for me as the provider. So I think it's just really great that you can keep this arm's length away of someone who just sits there and does it. And anything you do every day, you get better at. So it's also that. So, I mean, you guys have shared so much about what Support DDS does. I truly appreciate your time. I always ask this question. Was there anything that I missed, Nikki, that you wanted to share about Support DDS before we wrapped up?
I would say a transition that's happened in our practice is, like, right now, before we hire, we used to overhire. And before we hire, we play a little game like, okay, what can we offload? What can we get one of our support DDS people doing that we haven't thought of yet? So we'll sit down, maybe 5 or 6 of us in a room, go through our list, and what is something that we could offload on them. And it's saved me hires that used to 10 years ago, I would have just gone and hired another person,
right?
That may or may not have been, efficient use of our resources. So we play a little game.
Maximize efficiency, reduce overhead. That's like Dennis' favorite word. If you said to a dentist, go down the street, you can reduce overhead. They go, I'm going. That's their thing. So, Callie, anything I missed for Support DDS, and also share one more time how people can reach out to you.
I think bottom line, the buck starts and stops at the front desk. And the more that we allow our front desk to be very attentive to the moment and to the patient in front of us, and are able to offload, like Nikki said, and really get somebody proactively doing those things that are not always the most fun, you're going to see your numbers go up, and you're going to see your team retention because they're happy, and they're not having to do all those things that drag us down. And you can reach me at Callie, CALLIE at supportdds.com. Go check out our website, supportdds.com.
Awesome. Well, I have tested this myself in this world and all of my businesses, Nacho, Job Connect, my dental offices, and I am so glad that I have it. Much like our dental patients, Nikki, what I will say is I wish I had done it sooner. I wish I had known about it sooner. Just like when people do a great implant case or cosmetic case, they say, I wish I had done it sooner. And your team really deserves it. They deserve you to get the person who can decrease stress. Thanks so much, guys, for sharing with us today. We really appreciate it.